One of the really important topics that we have nowadays is oligometastatic disease, where we actually don't really know always well how we want to treat. And there was a very nice session about oligometastatic disease with an interesting panel of radio-oncologists, if I remember well, also oncologists, then it's someone from radiology. I think that was really very smart to have a radiologist in that panel. And in that sense, it was really a quite important session as well, because it has so much changed with the advent of PSMA PET CTs. So we see so many more patients with oligometastatic disease. If we take the PSMA PET, because now a lot of patients with high-risk disease are staged with a PSMA PET, and even if in conventional imaging they would be negative for metastasis, so M0, now we find in the PSMA PET single metastasis. And so this is really something that we see more and more. The same thing happens with biochemical relapse. Now, in a lot of countries, the imaging of choice for biochemical relapse is PSMA PET. And of course, we see many more oligometastatic patients than with the conventional imaging. So in that sense, I think it's really a whole new group of patients. Personally, I think, even if in the studies that we have, in a lot of these studies, the patients were defined by conventional imaging. Nowadays, and we saw that also in our consensus conference, most people would add on a PSMA PET to be sure that these patients are really oligometastatic. And we had a lot of discussion. There was a lot of discussion. I mean, is it 3 meds that are the upper limit? Is it 5? I guess, in the end, nobody really knows. It's not so clearly defined in a lot of trials. 5 is taken as a cutoff. So I think that was quite an interesting discussion around this topic and how to treat these patients. And of course, it's different if these patients are de novo oligometastatic or relapsed oligometastatic, or even oligoprogressive, so on the treatment and only 1 or 2 of the lesions are growing or are new, and all the others are stable. So we have a lot of these new kind of situations.